Hi! Welcome to Doc Martin's YouTube channel. Happy World Spine Day! October 16 is celebrated annually as World Spine Day. So this week we are joining the World Federation of Chiropractic in recognizing this global initiative. We find this to be increasingly more relevant given the global Corona-19 pandemic. A combination of long lockdown periods has left our communities restricted in their movement and mobility. Our spines are ultimately linked to our mobility, which is directly related to our physical, cardiovascular, and metabolic health. So good spinal hygiene can ultimately contribute to improved health and longevity overall. My next videos are about showing you simple tools you can use to improve your overall spinal health and mobility while seated at work. The first one will show you strategies for mitigating lower back pain, while the next one will be focused on upper back and neck pain. So, let's get cracking! Spinal disorders are a leading cause of disability worldwide. Our spines are related to not just our overall mobility and functionality, but to our willpower, courage, and vitality. As anyone who has ever suffered from tremendous back pain will tell you, it can be completely humbling and depressing experience to be held hostage in bed by sharp shooting, stabbing surges of pain in your lower back and legs, or in your neck and head, both of which are the two most common forms of spinal pain and disorders. Just to share with you some fast facts about back pain. Low back pain is the single leading cause of disability worldwide, according to the Global Burden of Disease 2010. Back pain is one of the most common reasons for missed work. In fact, back pain is the second most common reason for visit to the doctor's office, outnumbered only by upper respiratory infections. Experts estimate that as much as 80% of the population will experience a back problem at some point in their lives. Most cases of back pain are mechanical or non-organic, meaning they are not caused by a serious condition such as inflammatory arthritis, infection, fractures, or cancer. Americans spend at least $50 billion each year on back pain, and that's just for the more easily identified cause. And in the Philippines, low back pain is ranked number 1 in terms of years lived with disability for the last 20 years. Scientific studies agree that structured exercise programs are first-line treatments for persistent back pain lasting over 12 weeks. Since work-from-home arrangements have left our population sitting for prolonged periods of time, I thought of showing you some of my favorite spinal mobility and stabilization exercises that can be done while seated at your workstation. Alright, time to take a stretch break. Okay, so for the first part, we're just going to show you some simple stretches that you can do while in the seated position. So, step 1, sit at the edge of your chair and plant your feet firmly on the floor. Next, keep your knees directly on top of the ankle, and we're going to start with doing some simple decompression breathing. We talked about this in our last video. So, the two elements of decompression breathing is to inhale and lengthen the space in between your hip and your rib while you're expanding your chest from here to the shoulders and you're lifting the skull up. So the ribs go up and out, this lengthens and the skull lifts up. And we'll do a couple of breaths in that position, 3 to 5 breaths. Okay. Next, we're going to use our hands as a tool to strengthen the muscles of the inner thigh and the outer thigh. Both muscles stabilize the pelvis during movement. It is essential for good posture and back stability. So we're going to put our hands here on the inner knee, and we're going to put about 10 or 15 pounds of pressure, pulling the knees in while your hands resist. Hold that for about 5 seconds and repeat 3 to 5 times. After that, we'll take your hands and put them on the outer portion of your knee. Okay? And now we're going to push against our hands, about 5 to 15 pounds of pressure, 3 to 5 times, then you relax. Let's go to the next exercise. Okay? Now, from this position, we want to flex our spine forward. So, you come here and run your hands on the inner. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And do this 3 to 5 times. It's important that as you run forward, you're flexing your spine. And as you come back up and extend and exhale, you're extending your spine up. So you're trying to get as full a spinal movement as possible. Okay. Next, we want to cross our legs like this. Keep this parallel to the floor, and now we'll be stretching the muscles of the buttock on the right side. Bring your elbow to your knee and stretch it downward like this. Being mindful not to collapse your spine, keeping your spine straight and pulling down. And you should feel a gentle stretch in the hip and the buttock area. Hold for 5 to 10 seconds, repeat 2 to 3 times. And then place this firmly on the ground and repeat the same process on the other side. Okay. Now, after that, we're going to now stretch our spine into rotation. So, cross your legs. This time we'll leave this at a 45 degree and we'll just use this hand and rotate your spine to the right. (45°) and then to the left. Okay? Hold for 5 to 10 seconds, repeat 3 to 5 times. Now, the last muscle we're going to stretch for this series is the muscles of the hamstring that run behind the leg. And what you do is you just extend one heel on the ground and you bend forward. Remember, as you bend forward, you're using your hip hinge pattern that we learned in the last video. And just bend forward as far as you can until you feel a gentle stretch down the posterior chain of your right leg. Hold for 3 to 5 seconds. Repeat 3 to 5 times. Do this on the other side. Heel plants on the ground. Remember the hip hinge. Bend forward, stretching the posterior thigh. 3 to 5 seconds, 3 to 5 times. Let me know which of this worked best for you. Remember that although most back pain is mechanical in nature, you do have to watch out for certain red flags. Although rare, if you have any of these symptoms, please consult with your healthcare provider immediately. Loss of urinary or bowel control, unexplained loss of weight, night sweats, complete numbness around the anal area, or a loss of control of your legs or arms. You may also feel some discomfort doing exercises for the first time. However, if you persist, your back will adapt, get stronger and more stable so you can live a life relatively free of back and spinal pain. This is Doc Martin saying, every day, in every way, you are getting better and better.